Hi, good morning everyone to our MMI interview webinar. This is meant to be a really interactive session, and thanks for getting up early on a Saturday morning to come and attend. My name is Dr. Ankit Chadha, and I'm a first year doctor in London, currently working at Charing Cross in mental health, and we'll introduce you to the others as they come onto the screen. The aim of today is really for you to try and ask as many questions as possible, and for us to give you the key advice that we had when we were applying to medical school, specifically for the MMI interview course. We're going to use a Slido, so if people could just scan the QR code or type that in and just trial sending us over some questions, just so that we know the system's working. And we'll be using this throughout the sessions, so we can try and make it as interactive as possible. We're also going to, if you can't think of questions during, we're also going to have a Q&A at the end. So feel free to drop in any questions, but we really want it to be as interactive as possible. I remember going to a few of these workshops when I was applying, and I was so scared of asking any questions. But I came home feeling with a bit of regret, and I don't want any of you feeling like that today. So if you have any, just feel free to drop them in. So I'm going to get... Okay, so we know it's working. We've got our first question, our first comment here. So good morning, everyone. All right, I'll return to this later. So officially then, welcome to our MMI interview workshop. And the aims of this morning are really to learn about the key stations of the MMI interview. We're not going to be able to cover every single station because they're going to differ between medical schools. But you'll find that there are certain similarities, and you know some stations that will definitely come up. Then we're going to try and understand what the admissions tutors are actually looking to see. At the end, you'll get the chance to see a model mock MMI interview with Dr. Ellie Phelps asking me some questions and me trying to give the best responses. And then at the end, as I said, you'll have time to ask any questions that you want. So the timetable is, for the first 20 minutes, it's our basic introduction, and then how to conduct interviews over Zoom. With COVID and the pandemic this year, there's a chance that a lot of your interviews will be over Zoom. So we'll be seeing how to confront this, because you want to come across just as well as in face-to-face. Then we're going to check a really important session, which is how you can use your personal statement to create your interview answers. After that, Dr. Ellie Phelps will be covering the medical ethics station. And this is a really important one, because as resources get more and more scarce, you might be asked to make these decisions. Then at 11, I'll go through with you how to do the data analysis station. And I think that's really important as a doctor, as you'll be learning how to interpret scans and blood results throughout your life, and we'll have to explain them to patients. Then at the end, you can watch a model MMI interview, and then finally we'll finish off with some time for questions. Okay, so our first session is the introduction and how to conduct interviews over Zoom. And for this, we're really lucky to have the head of biology at Long Road Sixth Form come and talk to you. So Paul, would you like to turn on your camera? Okay.
Brilliant. There you go, Ankit.
And I will let you take it away.
Fantastic. Okay, if we have the first slide then, please. This was a cartoon I found in a magazine recently. I showed it to some of my students, and some of them were a bit like, I don't get it. I mean, the idea that the person on the right is the patient and the person on the left is the doctor. And normally you go to the doctor to unload your problems. And before the patient's managed to say anything, the doctor's unloading his problems, saying, I hate my job, I'm overworked, I'm undervalued, I'm at rock bottom. And I just thought it was really interesting that this cartoon has appeared at the moment, where doctors are very high profile because of COVID, but people realize that they're having to work incredibly hard. And that could be in a hospital setting, it could be in a GP surgery. And this just really summed up to me that as a medical applicant, you have to know what you're getting yourself into. And this is a really important part of the interview, that you are fully aware of what the career is that you're trying to do. It has very, very high highs and very, very low lows. And you've got to be able to deal with all of that. So I just thought that was a really pertinent cartoon. Okay, next slide. So the idea here is saying medical interviews are very difficult to get. One training session I was at over the summer, some medical school doctors were saying probably because of COVID, medical interview applications have gone up significantly in the last 2 or 3 years. You're talking about something like a 25% increase in applications from people like yourselves. The number of medical school places has also gone up, but not by that much. So the government knows there's a problem with lack of doctors, and they have funded more medical school places, but the number of people applying has far outweighed the number of places available. That means getting medical interviews is really difficult. And it may be some of you have got some interviews lined up already. Fantastic, well done. According to these medical professionals, I found it quite hard to believe, but they said that the majority of students in year 13 get no interviews at all. The majority get no interviews at all. I was quite shocked by that. But then other people might get 3 or 4. So if you get one interview, you've done really well, and you've worked really hard for this. Remember, you've gone through year 12, maybe reading books on medicine, you've gone to work experience, whether it's virtual or real, you've done some research, you've written your personal statement, then you had to do the UCAS, the UCAT or the BMAT or both. It's been really, really tough. And finally, after all that, let's say you're lucky enough to get yourself an interview, you may only get one. That might be it. So you can't think, okay, the first one will just be a practice and I'll take it from there. You can't do that. This is really important. And I think the good news, if you have got a medical interview, the chance of you getting a place now dramatically improves. You've actually got an interview. So I don't think anyone can put a number on it, but possibly 50-50 chance now, you've got a chance of getting into medicine. And I think that the point of today's session is to increase that chance as much as possible. So hopefully by midday today, you'll come out of today thinking, I'm in a much better position now. So when I get that interview, when I attend that interview, I can do a really good job and my chances of getting that place have massively improved. Okay, next slide. What kind of style interview will it be? Today's session is all about MMIs, but remember you could get a panel interview and you can see here 3 stony faces looking at you. Typical panel interview, sort of 2 to 5 people. The other one, the MMI, if I can have the next slide, please. Medical schools seem to more prefer this one. I think they can better work out if you're a suitable candidate. This is what they think from an MMI. So more likely you'll get something like this. Next slide. Ankit's already said that online interviews, and that's something I'll be talking about in a moment, is most likely, but definitely I know that some of my students have got interviews at UEA and Bristol, and they are face-to-face this year. So first thing I would say to check, if you get that message saying you've got an interview, just check, is this face-to-face or is it online? Is it through Zoom? Probably through Zoom, but it could be face-to-face. That's the first thing that I'm asking my students. Next slide. Okay, put yourself in the position of the admissions tutors. What is the purpose of the interview? They're trying to find out, have you got the right attitude and attributes to be a doctor? So they've sat down how to think about that. And they're thinking, what sort of skills are we looking for that can be demonstrated by the candidate in the interview? There's a list of 5 here, look. So communication skills, verbal and non-verbal. So, you know, what you're saying and how you're saying it, really, really important. Non-verbal is everything else they can see, whether it's face-to-face or on that screen that you're doing. Interesting, we had at Long Row Sixth Form College, we had a couple of GPs in to talk to my students a couple of weeks ago. And I was quite surprised how bad their communication skills were, really. And when I asked the students afterwards, they were like, they didn't make eye contact very well, did they? And you know, they weren't asking the questions very well, and they muttered and mumbled a lot. And I thought, yeah, I was really surprised that these GPs were not very good at verbally communicating with my students. I'm sure they're brilliant GPs, but I thought if I was interviewing you for a teacher's job, I wouldn't give it because you're not coming across very well. So the way you say things and your body language, really, really important. So do practice that. Get someone to listen to you. Are you being clear and concise? And what about all those non-verbal things? Where are your eyes? They're wandering all over the place. What are your hands doing? Are you shuffling around? Is your head down when it should be up? All those things, someone can help you because we don't realize we're doing it. So, or even get someone to film you, even better, you can watch yourself back. Quite a painful thing to do, but that can be really illuminating. Professional judgment, I think that'll be covered later today. Empathy, really important. You've got to be able to put yourself in the position of your patient. Really, really important to do. Data interpretation and numeracy, it's not a maths test. They're not going to set you some complicated maths thing, but you know, doctors have to deal with numbers and they have to deal with data. You are a scientist after all. So the fact that you're probably doing 2 science A-levels means that's something you probably don't need to worry about. It'll be covered later how to go about it, but don't worry about that. It's not going to catch you out. And the idea of problem solving, doctors solve problems. That's what they do. So they want to see, well, how good are you at solving problems? Whether it's a mental problem, or if they're doing it face to face, they could give you something in your hands to solve a problem, like build a model or build an aeroplane or something out of paper. And that could be a multitasking thing they're looking at as well. So all of those would be the key features they're looking for. Next slide. So here's your panel interview. These are less common now. And today we're looking at MMIs really, but they've quite a lot of overlap, to be honest, and the questions may be incredibly similar. But just a quick look at a panel, 2 to 5 people. Who are these people? Probably tutors from the course, doctors, and the doctors may be the tutors from the course, they often are. Another member of university staff, they often use medical students, and they may have some members of the public. But if you've got 5 people confronting you, they're not all going to be firing questions at you. That'll just be 2 of them, and the rest of them are just observing and taking notes. Don't be fazed by the fact that while one person's talking at you, someone else is writing something down. Of course they're writing things down. They have to have records of that interview and how you came across. Just ignore that person. Focus on the person who's asking you the questions. And that's going to last sort of 15 to 30 minutes, something like that. Okay, next slide. The MMI one, much more common. This seems to be the way things are going now. And again, as Ankit said, every medical school does things differently and you can't be prepared for everything. But typically, they are 5 to 10 minutes long. And typically, there are 5 to 10 of them. So, you know, those sorts of timeframes you're looking at. Some medical schools on their website will tell you what the MMI stations will cover, and some don't. Some medical schools will tell you which questions they're going to ask, most don't. So if you have got an offer of an interview, go straight to the website and see what are they telling you. Is there any information they're giving you about the interviews, which obviously is really important. The sort of shadowy people at the door, you can see they're reading something off the door. And the idea is you may get some sort of scenario before you go in. So you could be presented with some information and maybe a minute to get your head around it before you go in. That's fairly common. The last one says, look, you'll either be asked a question by an interviewer or have to engage in a role play scenario. You might think, well, if they're doing a Zoom call, can they do role play? Well, one of the medical school people I was talking to said, yes, actually, we do role play over Zoom as well. So be ready for that. They could still do some kind of role play thing, even though it was over Zoom. I suppose the idea there is that a lot of GPs these days are making calls and talking to patients over Zoom. And so there you go. You know, you're a medical student doing something over Zoom. So why not? Next slide, please. This is just some of the things that can be asked at an MMI station. So work experience and insight into the career. Work experience is tricky with COVID, everyone knows that. You may have had face-to-face work experience. If not, hopefully you've had some online work experience. Really important for you to reflect on that and bring that out in your answers. One of my students said something really interesting she observed at work experience in a very small GP surgery during COVID, and there was a shortage of doctors and the receptionists were doing the triaging. And I thought, wow, that's really interesting, because they're not medically trained and yet they're having to decide the priority in which the patients are being seen. So I'm not saying that's the wrong thing to do, but I just think it's really interesting. What do the receptionists think about that? Is it something they're comfortable with? Have they had any kind of training? That to me opened up a really interesting question. Insight into the career. When the GPs came into college a couple of weeks ago, one of them said, in his words, the majority of GPs work part-time. Well, why is that? The impression I got was it's such a hard job to do that 5 days a week is just too much. So that they work 4 days a week or 3 days a week. That's something I'd want to find out more about. Professionalism, can you do the job in the way it's meant to be done? Empathy, we've mentioned. Breaking bad news. This is something doctors have to do. They have to break bad news to people. And that could be a role play thing. You've got to break bad news to a member of the sports team or something. Ethics will be covered later today. Current affairs, do keep an eye on what's going on in the news at the minute. Obviously, COVID's a big one, but no other things as well. It's not just COVID going on in medicine. There's something to think about the sort of social care beds and diabetes and obesity. All important things as well. Problem solving we've talked about. Teamwork, leadership. Obviously, doctors work as part of a team and often lead that team. When have you demonstrated teamwork and leadership? If you've had some teamwork or leadership sporting role, get that out interview. That's really, really important. The fact that you were captain of the netball team for 3 years or were training the juniors, really, really important to get that across. Personal insight and reflection, we said, what do you know about the job? You have to know what you're getting yourself into. You're really excited about it. You've heard about the ups and the downs, but you still really want to do it. Last one at the bottom, look, the medical school, the university, the city. If you get an offer of an interview, straight onto the website, find out everything you can about the medical school. How do they go about things, whether it's the method of teaching and learning, how do they do dissections or prosections, how is their course structured, how is the learning structured, everything you can find out about it. And then the university itself, what's so important about the university, what's so good about the university, and also the city. Being a medical student, it's not just about being a medical student, it's about being a university student and living in that city. Find out all about those as well. Next slide, please. Okay, so this is saying each station is scored as you go along, so they're just going to write a number down, add it up at the end. People have said MMIs are not the best way of judging how good a candidate is. No, everyone knows they're not perfect. And medical schools will say to you, yes, we know we get it wrong. We know some really good candidates slip through the net and don't get offered a place. And their advice is, if you really want to do this, take a gap year, apply any gap year, apply to the same medical schools, not a problem. In fact, most medical schools would welcome a reapplication because you're showing your determination to do this. So, and they know they may have, you slipped through the net first time around. They are fully aware of that. And remember, if a station does go badly, forget about it and move on. One beauty of the MMI system is, I don't know, let's say you've had 6 stations, 4 of them actually go really well and 2 of them don't. That's fine. That might be, it's not a problem. When they add up your scores, you're fine. If you're in a panel interview and things are going badly, you might find it's more difficult for you to move on from something that's just gone quite wrong because the same people are still looking at you. MMI is completely different. And remember, with an MMI, you can keep using the same anecdote for every different person you meet. So the fact that you're captain of the netball team, you might use that in 3 or 4 answers in MMIs because they don't know what you said to the other people. At panel, you can't do that. You can only use it once. But there are definite advantages to this MMI system. Next slide, please. Okay, just a quick about Zoom meeting because the time's getting on. Next slide, please. First impression is really important. This was a student I found online who was practicing or demonstrating how to do an MMI interview. And you can see she looks tidy. The background looks good. She's clearly combed her hair. She's ready for the interview. Next slide. This is just saying, practice saying things out loud with someone else listening, because obviously people are going to be listening. Next slide, please. There's quite a long list here. I mean, you can review these later, but do have your photo ID with you because they might ask to see your passport or driving license, UCAS ID number, make sure you've got that. They may ask you just to pick up your laptop and just show around the room to make sure you haven't got 3 doctors and a nurse sat behind you shouting out answers. Make sure your room's nice and quiet. You don't want your dog bounding in with muddy feet coming in from the walk. Good internet connection, of course. Make sure you are somewhere where Google Chrome seems to be the one they go for, and your little brother's not on his video game or watching a film next door and sucking up all your internet. Headphones and microphones are recommended. It seems that can reduce audio and visual problems. Have your mobile phone there just in case, and give them a number. So if it all crashes, they can phone you and just carry the interview on over the phone. Make sure that your background looks appropriate, nothing too horrific. And don't be backlit. Don't have like the light behind you so you're in shadow, otherwise they can't see your face. Next slide. You must be on your own. They may well check that. Do not have anyone else in the room. That will A, put you off, and B, will means that the interview isn't valid. How should you dress? Smartly, even if it's the top half. So as if you were going to work in an office. Don't record the session. That is basically illegal. You can't do that. So never do don't write down any questions. Don't record anything. That's just not allowed. Do have an air of confidence. Now, I know this might sound a bit crazy, but at least pretend you're enjoying it. So come across, be smiley, as if actually I'm enjoying this. It's a kind of cat and mouse. It's almost like a game you're playing here, that they're trying to catch you out and you're not going to be caught out. So if you can enjoy it, or at least pretend you're enjoying it, that will come across really well. One thing a medical student said to me was try to be memorable in a good way, because they're interviewing a lot of people. And if you have like a very unusual hobby, this one medical student said to me that they were in a group where, this was at university actually, they used to go hiking up mountains, and when they got to the top of the mountain, they'd take photographs of each other whilst doing some ironing. So they took an ironing board, an iron, and a shirt, and they'd set this up on top of the mountain and photograph it. And this was their club, this was their university club. So if you have got some unusual hobby, which just makes you a bit different without sounding too crazy, that might be good to get in there as well, just so it makes you memorable. Something else medical apart from COVID to talk about. So, the thing about GPs, for example, why is it the majority of GPs only work part-time? I'm interested in that. Training pathways for something you're interested in. Boris said he wanted 6,000 more GPs. He said that 2 or 3 years ago. Since then, there are less GPs than when Boris made his statement. But to be fair, it does take 10 years from entering medical school to become a GP. So it's not going to be a quick process. So if you're interested in being a GP, do make sure you know the pathway. Final thing, look, don't read from the screen or post-it notes. They can tell. It's so easy to spot. So just don't do it. Have the answers in your head, not too rehearsed. Next slide, please. Nearly done. Interviews are conversations, and the interviewers are permitted to ask follow-up questions to your answers. So just be prepared for that. They don't just have a list of questions they work through. You might say something and they think, aha, I'm going to come back with another question based on what you've just said. And interviewers are interested in what you can say to them, not what you can read to them. Reciting answers is not desirable. Marks may be deducted if they believe you are using notes. I got that information from medical school. So if they think you're reading stuff or using notes, that's likely to knock marks off. Okay, next slide. That's it. So that's it from me. So genuinely good luck. If you are lucky enough to get an interview, really make the most of it. You've worked so hard for this. Give yourself the best shot you can. And I'm sure today's session will really help with that.
Well, thank you very much, Paul. What I'd like to do now is, I know we ran over time a little bit, but I think the students really find it useful asking you some questions. So I actually invite you to stay on the screen if you want to turn your camera back on and ask and answer some of the questions. What I would say is we've also noticed some questions coming in the YouTube chat. What we'd recommend is that if you hold off the questions on there, we'd try and ask most of them through the Slido, and we'll have time for this. We also noticed that there's been a few questions coming in about the ethics station, for example. We're going to try and keep the questions relevant to the session that we've just done. So don't worry, we'll definitely answer your questions about the ethics and all of those, but probably in the next session. So the first question is there such thing as too much eye contact during interview?
I love that question. You've got to make eye contact. When this GP the other day didn't, it was so noticeably awkward that all the students noticed it. So make eye contact, but don't stare them out. I mean, just like you normally would, when you're talking to someone, you normally make eye contact. Make normal eye contact, but only focus on the person who you're talking to. If there's a panel of other people, ignore them. Talk to the person who is asking the questions, but only in a normal way. Don't stare at them, make them feel uncomfortable. So basically, do make eye contact.
And how are you meant to? I think this question is more about how the procedure works. An MMI interview, if it's online, I'm guessing is that thing. Is it over Zoom? Are there breakout rooms?
Yeah, I've not experienced it actually, so it's hard to say. But I think it's a bit like we're doing now, where they just switch from person to person. I think that's how they would do it. So it would be like, I mean, you're just sat in your bedroom, but they're just swapping from person to person to person in the way that we are now, I would say.
And you'll get, if it is an online interview, you'll get sent very explicit instructions in advance about who to call if you're getting technical issues. They've experienced all of this last year, so don't worry about that. It'll be clearly defined. It will just answer a couple more. I like that one. Is it a bad idea to mention the speciality that I'd like to specialize into? For example, forensic pathology.
Yeah, another really good question. I don't think it's a bad idea to mention it, but I think it's a bad idea to say, I've decided what I want to do and you're not going to change my mind. That would be very wrong. I like the idea of saying, this is where I'm currently interested in. And if you've done some research into that, that's fantastic, even better. You've read up about it. But I think it'd be wrong to say, well, I'm going into medicine because I definitely want to be a forensic pathologist. That's it. Because you haven't experienced being a pediatrician, you haven't experienced working with old people, you haven't experienced any of these things. So yeah, have it as an idea, but you are literally saying, this is my current thinking. I'm not definite because there's lots of other areas of medicine which I haven't experienced yet, and I want to experience them. But as I'm sort of sitting here now, this is what I'm thinking of. That's fine.
Yeah, and just to add on to that, we covered this in our personal statement, of course. At your age, less than 90% of the people who think they want to do one speciality actually end up doing it. So you'll sound very ignorant if you say, this is definitely what I want to do. You can introduce themes and say it interests you, and that's great, but it would be a bad idea to say, this is what you're going to specialize in. Okay, so we'll have one more question. So I'm going to ignore the medical ethics question for now. This will be recorded and available to watch later, so for anyone who's asking. I think the last one there is, what should we do? Okay, so a lot of them are quite similar. So thank you, Paul, for that session. I think we'll move on to the second one. And if you do think of any more questions for Paul, there's always time to answer those at the end. So let's go back to our PowerPoint. And we're on to the second session now, which I think is a really important, which is how to use your personal statement for the MMI interview. And this is really important because a lot of students forget. It's almost when they're asked, why do you want to study medicine? They start getting very nervous and they struggle to think of what you can say. However, just remember that your personal statement is 4,000 characters on why you want to study medicine. I always say the best answer to this question would be if you literally got your personal statement out and read it to them, because that is a whole essay of why you want to study medicine. And people think that, oh, that was a separate thing. I need to do completely new stuff for the interview. No, your personal statement is the best asset of all things about your work experience and demonstrating your qualities. And the two skills that we're going to cover in this session is first, how to use your personal statement to demonstrate qualities. And these could be for generic questions. And then also how to expand on specific stuff on your personal statement if they grill you about it. So part one is using your personal statement to demonstrate qualities. And what you need to do, we cover this in our personal statement course, and again in our MMI course, is the first thing you need to identify what are the qualities that make you suitable for medicine. And when we ask students, they all get these ones, which are empathy, communication, honesty, ethical awareness, teamwork. But what you can't also forget is that medicine is a very difficult and scientific career. If you are just bringing up examples of how you're a nice person. There's many nice people, but the reality is not everyone has the mental capacity to study medicine at the end of the day. So you also have to demonstrate your problem-solving skills, your intellectual curiosity, and your communication skills. So what I would actually do is I'd write a list of these and bullet point them, and basically find in your personal statement where you can demonstrate these qualities. So as I've said, your personal statement is the best source for demonstrating this material. So either people forget to talk about it completely, or they only mention their personal statement if they're asked about it directly. For example, you mentioned this piece of work experience, tell me more. That's actually wrong. You should try and bring up your personal statement as many times as possible, because I'm sure it's really good. So as I've said, there's top evidence in there which you can use in your interview answers. So what I'm going to show you is how to extract the different elements of your personal statement and then develop these to produce great interview answers. So the first thing is, remember, you need to, if you get given a question, and you can try and guess what questions will come up, try and pick out the qualities that they are looking to see in this answer. And then you go one step further and find the specific examples in your personal statement. So this means whenever you get asked a generic question or a question about a quality, you know you have specific pieces of evidence to mention. That means your answers aren't wishy-washy, they won't be generic, they'll be to the point, but most importantly, well supported by evidence. So let's have a go. The question was, when have you shown leadership skills? So obviously, the quality that they're looking for is leadership. However, I'd dig a little bit deeper. What are the qualities of a leader? And a leader has to be able to work with others, so that's teamwork. They might have to empathize with other members of their team. They might have to be organized, but crucially, they'll also have to demonstrate good communication so their team knows what's expected of them. So can you see how from a question we've derived what qualities the admissions tutor is actually looking to see in this answer? And then we can go one step further and look at our personal statement. So we had an example personal statement, and I've taken these examples from there, which is, for example, teaching primary school children the piano. That shows that you can communicate, especially with younger children and people who might not have the same level of knowledge as you. The other thing is you might have organized and run a science club for the lower years. Similar way, you're teaching the lower years. You're also demonstrating your organization. If we cover another one, let's look at the last one there. What was the most stressful situation you ever faced? How did you handle it? Now, in this question, there's no mention about any quality. There's no mention about your personal statement as well. So a lot of students might get stumped and start thinking, what do I do? How do I answer this? But if you are able to draw on an experience from your personal statement, you'll know a lot more about it. So again, using the formula, the qualities that they're looking to see is not just someone who got really stressed. It's someone who overcame that stress. For example, by being really dedicated, by being motivated, and also problem solving. So whilst this question is asking about a negative experience, the qualities that they're looking to see is how you overcame that negative experience. And once you understand that, it's very easy to pick any example. For example, you were volunteering as part of the ambulance service and you found an injured person. That would be really stressful. But if you can demonstrate you worked with the other paramedics, you tried to stay calm, you called the 999 operator, and you managed to keep the patient calm, that shows that you handled it very well and that you problem solved and were dedicated. Similarly, your most stressful situation might have been performing violin for a school concert. You might have had stage fright. However, you can then elaborate on to say you overcame your fears. You might have practiced for months beforehand to make sure that you wouldn't freeze on the day. And that is how you show you handled it. So despite none of these questions referencing your personal statement, I want to show you that you can always answer a question by finding out what qualities they're looking for and then using evidence from your personal statement. And if you have that skill, you'll feel almost supported to answer any question that's thrown at you. So to do this, you need to make a list of qualities that you think will be asked, and I gave you that, and then find them in your personal statement. And we can't do that for you, but that is for you to do. So go through your personal statements. That's why they say you need to prepare your personal statement. It's quite vague what they mean, but this is what they mean. Find the qualities and find the evidence that matches up for them. Okay. So for the second part is, how do you actually answer questions if you're asked specifically about them in your personal statement? These are a lot easier, but I think that because they're asking you about your personal statement, the interviewers are going to be expecting more. So if you give generic answers or simply repeat exactly what was written, that's going to score quite poorly. Instead, they're looking for you to develop your answers. So some of the things that they could ask is, what did you learn from this particular work experience? What's the favorite part of that book that you mentioned? Like, it usually will be about work experience or about something academic. So for this, I'd recommend a 3-part formula. And this is basically elaborating on how you should have written your personal statement anyway. The first thing is, whenever they ask you about something, even if they're asking you what you learned, you must make sure you explain exactly what you did. Usually in your personal statement, you'll only have time for a line. For example, I shadowed this doctor and I saw him interacting with patients. But here's your opportunity to go into so much detail. Give a very detailed account: who you shadowed, who you met, what particularly interesting parts there were, because that will help really show that you were there rather than just making it up. But also that demonstrates your interest, that you can remember all the small details. Then you need to talk about what you learned. And that's where you need to go back to those list of qualities. So again, despite them not asking about qualities this time, you have to mention them, because this is basically a sales pitch explaining that you have the qualities to be a doctor. And then the next thing that you do is you have to elaborate on what you did next or further research. And that will be the key way in how you differentiate yourself. A lot of students might just answer the first point. The really good ones will answer both, mentioning those list of qualities. But really exceptional students will take that and then explain what they did further from that experience. That is the way you show intellectual curiosity and motivation, that you didn't stop there. You're going to talk about stuff that maybe you didn't even have time to mention in your personal statement. And that will be a really compelling answer. So we're going to go through one example of how to do this. So this is a paragraph from someone's personal statement where he's just basically said, every Monday for 6 months, I shadow a local GP. I've seen him develop complex medical and well-being device, and that showed good communication skills. That's usually all you have time for in your personal statement. So let's suppose you get asked, so tell me, what did you like about this work experience, or what did you learn? Go through those 3 points. So the first thing is, explain in detail what you did. Now I'm going to expand. I'm going to say, I wanted to get a better insight into the lives of doctors. I shadowed this local GP. Then I saw him make consultations and how he spoke to members of the healthcare team. And then you're going one step further. You encountered many medical problems, especially mental health issues and surgery. And specifically, you encountered a patient with carpal tunnel syndrome. You saw how you learned a specific procedure, which is how to test nerves. And then you used that later. And then you might have also had time to attend a home visit to a man with severe Parkinson's. Can you see how you've elaborated on this work experience? And that shows you're really keen, and you didn't just stand there and watch, but you learned specific skills. The next thing is what you learned. So here is where you're going to drop in those qualities. So for example, you were impressed about the GP, how he calmly reassured his patients and explained them in a relatable manner. So here's the name drop. You learned the importance of communication skills in being a doctor, and that's a skill you want to develop. Then on the man with the Parkinson's, you saw how the doctor was attending to the patient's fears and how he calmed him down. And then here's another part where you learned about, the importance of the empathetic skills and the softer skills of medicine. And then finally, you're going to explain what you did next. So after this, you realize the importance of understanding, how the NHS works, because you mentioned that, this is a part that could be improved. So then you read about the history of the NHS and how it was formed, and that you found it really interesting. And then you might use that to help at time pressures in the GP environment. So despite that asking a very specific question, what did you learn from this work experience? You've covered the whole range. You haven't gone off the topic because you are talking about that experience, but you've showed that, you have all sides. You very detailed about what you did. You name dropped the qualities, and then you've got one step further. So that's basically my take-home message from this session. I know it's a lot of information, and we do cover this in our course, which we'll tell you about all at the end. Your personal statement is your best asset, so do use it. you can use your personal statement in two ways. There's some extra bonus ways which you cover in our course, so do check it out if you're interested. But those are the core, and so best of luck. So what we're going to do now is, just because of time, we're going to go straight on to the ethics questions, and then there'll be time to answer questions about both sessions. So I'm just going to pass over onto Dr. Ellie Feltz now, and she'll carry on the next session.
Right, hello everyone. My name is Ellie. I'm one of the doctors working in London at the moment. I apologise in advance because I have a bit of a cold at the moment, so I'm sorry if I'm a bit sniffly on camera. Not COVID, PCR negative, but persistent cold. So today I wanted to talk to you guys about medical ethics questions. I know that facing, well, any sort of interview can be really intimidating, but particularly medical ethical scenarios, because a lot of the times there isn't a correct answer. What the examiners just want to see is that you've taken a considered approach and sort of thought about the different sides and come up with an opinion, but they're not being necessarily something that is correct, can kind of throw you and sort of put you in a little bit of uncertainty when you're facing these. But hopefully today we'll go over some top tips as to how to navigate these questions, and by the end hopefully you'll be a little bit more confident when it comes to your interview. So let's have a look. Some of you may be familiar with this, and for others it might be a little bit new, but the 4 pillars of medical ethics are a really good framework to basing your responses to ethical scenarios. This is a little definition of what each of these are. So autonomy, and that's the patient's right to make their own choices and for those choices to be respected. That's a very pivotal part of how we view healthcare. And then there's a little caveat to that, in that provided capable making an informed choice and understanding the consequences of that choice. If we have time, we'll go into that caveat a little bit later. So then the second one is Beneficence. Do no harm, weighing up the risks of an intervention that will cause a potential harm versus what would be the outcome if you didn't do anything at all. Beneficence, which is providing the best possible outcome for the patient. As going into a medical profession, I think a lot of people will resonate with that. You want to do good, you want to help people. And then justice. We as doctors and as a healthcare organisation need to make sure that we're treating people fairly. So those are 4 pivotal principles that we rely on when we're making healthcare decisions. So then how do you go from those points to coming up with an answer in your interview? So I've got an example here. I'm just going to go through it together, and then if you have any questions we can go through them at the end. So this is Mrs. X. She's a 77-year-old lady who, sorry, I've done this very medically, but has a past medical history of asthma. She's been recently diagnosed with dementia, but it's quite early stages in her dementia. And she's also been found to have colon cancer, probably on the routine screening that we do. In terms of socially, she's independent, and then ADL is a shorthand that we use medically, which means activities of daily living. So she's completely independent at home, but she does struggle with her short-term memory loss, leading to her diagnosis of dementia. And in terms of important decisions, she relies a lot on her partner to help her with them. When we investigated initially, the staging scans didn't show that there was any metastasis and thought that the surgery might be curative. However, during the operation, there was some lymph node and possible liver involvement. The surgeon removed all the lymph nodes that they could see that were affected. And then post-op, when the patient is in recovery, he tells the patient that he removed all of the cancer. So what are the ethical considerations in terms of what this surgeon has told the patient? If this was in person, I would want to screen and find out what you guys think, and we could have a conversation about it. But in terms of this setup, I'm just going to go through under those headings of autonomy, non-maleficence, beneficence, and justice, what sort of the key points for and against are. In your interview, it's really important to be considering both sides of the argument, which is why we're going to do it in this way. And at the end of the day, your examiner is going to want you to have a conversation with them. They're not going to want you to be listing off things. It's got to be a little bit more fluid than that. But let's go through these points and see what the considerations are for and against. So in terms of autonomy, well, let's think about it. So against this, he's just assumed what the patient would want to know. He's assumed that the patient would want to know that he's removed all of the visible cancer. However, he's denied the patient the opportunity of the choice to be informed or not about the fact that there has been possible spread and involvement of the liver. So you're denying them choice and denying them future informed consent. Against this is this patient has been diagnosed with dementia. I didn't go into detail too much about how that is affecting their memory and how that's affecting their decision making. So when we do think about autonomy, it does depend a little bit on capacity in terms of capacity is the ability to understand, retain, and weigh up information and then communicate a decision. So if that is impaired slightly, then sometimes we make decisions based on best interests. But have we reached that stage in this lady's trajectory? We're assuming a lot by just doing this with the information that it seems the surgeon had. In terms of non-maleficence, the principle of doing no harm, against this would be, by saying this, you've undermined the trust that a patient has in yourself as a doctor. And maybe that would affect the relationship going forward in terms of the fact that if you've told one half-truth, maybe in the future, that patient is going to continue to doubt what you're saying and doubt your help. But on the other side of things, put this in potentially a more positive light, maybe what the surgeon has done is that they're delaying the conversation to a more suitable time. Maybe this is a busy post-op scenario, maybe the patient is just recovering from a sedation. So he wants to delay the conversation to a time where they can have privacy, they can go into a secluded room, they have recovered from their anesthetic, and they can bring the partner in to discuss with them present. And maybe that would be a more supportive environment for the patient to hear such news. And then moving on to beneficence. So in support, by saying something like this, he's lifting the patient's mood. It's a half-truth. But against it is this is very paternalistic medicine. You're doing what the doctor believes is the best interests without taking into consideration what the patient's prior thoughts are about what they would want to know and what they wouldn't want to know. You haven't gauged their best interests. And in terms of justice, against this would be that we're making premature judgments based on a past medical history of dementia, or being a bit ageist in the fact that the patient is older, and we're assuming that has an effect on their ability to process this information. So that would be considering the medical ethics and the 4 pillars. Sorry, I know that's a lot of information, and we'll go over it a little bit more in a second. But I just wanted to also mention the fact that there are codes of conduct, and these are centered on either utilitarian or deontology point of view. There is no right answer, there is no wrong answer. People fall on either sides of these codes of conduct, but I think they're useful to have in your mind, and to be able to talk about them and apply them to these scenarios. So just briefly, utilitarianism is maximizing happiness by choosing the action that produces the greatest good for the greatest numbers of people. So here, It's not necessarily about the actions that you're taking, it's about the overall outcome and whether that outcome is good. And that would justify the means of how you got there. Versus in deontology, it's about the actions that you do. And if those actions are morally wrong, or then that makes the action that you shouldn't do it, instead of no matter what the consequence or the outcomes are. It's the duty and the actions that you've taken that are considered. So in general, in medicine, we balance towards disclosure, and we balance towards giving people the right to decide their healthcare. And I've made the caveat here that that's often impractical and could be inappropriate, but you need to balance that with being this overly paternalistic and overly you know best approach. So when you're answering an ethical scenario question in interview, how do you go about it? I've given you sort of a load of information about what you could be considering when you are faced with a scenario like this, but actually converting that into a structured response is really, really difficult. Sorry, got a cough. So what I would do is I would go over the scenario a little bit and stress that I know that it's complicated and that there are going to be different points of views. And I would then decide to present the two different sides of the argument, considering the for and against based on those 4 pillars of medical ethics. And then at the end of that, if I wanted to bring in a little bit of the utilitarianism, or if I happen to know any of the law, or if I happen to know any more evidenced approaches, it's not necessary. I think people, the examiners, would just want you to be able to think about these problems and have a discussion with them. But if you've done some background reading and that feeds into the scenario, then that's really, really great. But I wouldn't bank on that. I wouldn't feel under pressure to do a lot of research, etc. So having thought about the different sides of the arguments, I would then want to come to a conclusion, and I would want to be able to have an evidenced answer and an evidenced opinion. So in this case, I think what I would end up potentially saying is that overall, giving people autonomy relies on supplying them with the truth. We shouldn't assume that a patient's best interests, we shouldn't assume a patient's best interests without prior exploration of them. And it wouldn't be fair to assume just on the basis of a past medical history of dementia that this information shouldn't be disclosed. And it would undermine trust in us as doctors to knowingly withhold this information. And again, I've just stated that in general, in medicine, we tend towards full disclosure, with the truth only withheld if there is a good justification for doing so, and on a case-by-case basis. This is a little bit of that further information that I mentioned that's not essential. It's just whilst you're here and you've attended this session, I thought I'd just tell you a little bit about it. In terms of consent, this patient, we've left out information and we've not told him the full amount of information, therefore further decisions are affected, and further interventions that we offer, we have to consider whether the patient has consent in those situations. So consent is defined by explaining what something is, how the intervention is going to help, and why you're going to do the intervention, what are the expected benefits. And you've always got to weigh that up with what the risks are. And those risks are what a reasonable person would want to know and what the individual person would want to know. And the reason why it's specified like this, is because, say for instance, you only had sight in one eye, knowing that there was a small risk of losing your eyesight would potentially be a bigger consideration to that individual than someone else. And I've just said briefly that failure to inform leaves you liable for assault because you don't have consent, and failure to provide information is a breach of your care, and you could be liable for negligence. So I've covered that really briefly. We'll cover that more in the course that we do, and we go into a little bit more of that background information. But again, I just want to stress the key thing in these ethical scenarios is to have a conversation with your examiner. You can base it on these principles and you can have these codes of conduct in the back of your mind. But what your examiner wants to do is just to see that you are thinking about it and see that you have taken the time to consider that there may be two sides of the point of view, two sides of the argument in terms of everything. These are some more of the different ethical scenarios that may come up. So I just talked about providing oral contraceptive pill, refusing treatment for life-threatening condition, euthanasia, abortion, consent, confidentiality. And then you might also be faced with some communication questions in stations where you may be asked, how would you break this bad news, or how you would deal with an uncooperative patient. And again, unfortunately, I don't have time to sort of go into and have a discussion with you guys about what these scenarios would involve. We do so in our course, so maybe check that out after. But for the moment, I think we will move on to the next section, which is the data interpretation section. In terms of questions, we'll have a Q&A and a web Q&A at the end where we'll combine all of your questions together and you can ask me a little bit more about the specifics. All right, let me just hand over to Ankit.
Okay, thank you, Ellie. That was really useful. And medical ethics station is one of the most important and difficult stations that you have in the MMI interview. I think it makes sense that we'll do one more session, then we'll combine all the questions together about data interpretation, ethics, and personal statement before we go on to the mock MMI. And so in terms of the data interpretation, a lot of students find this quite difficult because it's basically testing one main skill. Can you take complex information and present it so others can understand what you're trying to say? And that might be in the form of a table, a graph, a photo. And it is the station which applicants struggle at the most, because this is the only station potentially where they're going to provide you with something that you've never seen before. They're asking you about questions about your personal statement, why you want to do medicine, even ethical scenarios. You might have seen them before. You probably rehearsed about the law or the 4 pillars of medical ethics. Whereas this is the only place where they're going to give you brand new information and basically say, explain to me what it shows, and then ask you some more questions about it. And what happens is students might be really good at the first parts and then they crack at this. And then they know that, okay, that's not because this student is, genuinely really capable. It's just he's done hours and hours of practice. The good thing about this is that you could also do practice. You can't memorize particular graphs because it's a 1 in a million chance that that same graph will come up. But if you learn the structure and how to present it, then you'll come across as calm and composed in the station. And even if you make some mistakes or don't exactly know what it's trying to say, the very fact that you've stayed calm and presented it in a logical way, you'll stand out from all the competition. And this is really important as a doctor. Any investigation you do, a patient might ask you, what does this mean? Or what does the scan show? Do I have cancer, for example? And you're going to have to be able to interpret whatever scan you do and explain it to your patient. That could be as simple as a one-off blood result, or it could be an MRI scan or a series of scans. And anywhere along that spectrum of complexity, you have to break it down and put it in a way that your patient will understand. Your patient could be a consultant and they know more than you, or they could be someone who doesn't know what an artery or vein is, and they might have left school early, and you have to be able to cater to all those needs. And that's why this station is really important at your MMI interview. So for example, if I gave you this graph, this could be something. They might just say, what does this graph show? And they'll probably give you about 30 seconds or even a minute to look at this. The key thing here is if they don't and they just ask you, what does it show? It's important that you ask them can I have 30 seconds to look at this, or up to a minute? Because if you just start it, the first test is, do you have the confidence to ask some time to look at it? If you just ask them, if you just start explaining the graph without having looked at it properly, it's very likely that you'll get something wrong. And so that's the first test. Do ask for that minute or 30 seconds. So I'm going to give everyone, a bit of time. It's on the screen right now to actually have a look at this graph. Look at the lines, look at the results, look at the axes, exactly like you would do if this was in an exam question. Try and figure out what the units are, what the timescales are. They might not even be annotated on this graph. And that's something you should mention. Is this a perfect graph? Does it have a title? All those things that go into what is this graph actually trying to show. So we're going to come back to this and learn how to present this graph. Okay, so our advice is, how do you present it, or how do you break it down? And so we've come up with our acronym, which is TAP-VE. And this applies both to graphs and for tables as well. You just slightly change the third one. So the first thing is, you have to imagine that they've never seen this graph. And so when presenting it, you want to open it with a title. If it doesn't have a title, it's your job to give the graph a simple title. So because that will help just set the scene and basically say what the graph is about. Is it a geographical study about, the amount of forest cover in the Amazon rainforest? Is it about something biological or medical in the first place? The next thing that you do is just state what the axes are. Both of these points are really simple because you're not having to come up with any type of interpretation or even look at specific values. You're literally reading what the graph shows. And that gives you time to think about the more complex stuff. So define the axes. You could say the x-axis shows, time, and it's set in hours. And the y-axis, it shows blood glucose and the units for that. And that will basically help you define the variables. So the independent variable is time, and what they were measuring was the blood glucose. So now you can already see you're trying to convert it into a scientific answer, and it's helping set the scene. Then the next thing is trends. Now here, I don't want to hear any specific values. You just want to explain what the trend of the graph shows. Is the line increasing? Is it flat? Is it going down? That's basically it. Then you can point to specific values. For example, what's the maximum or the minimum value? Or is there any point which stands out amongst the rest? And then only after you've done that, I'd go on to the explanation. Explaining, give a reason why the graph looks like this. Is there any biological mechanism which explains why you might do this? If you start with the first one, you're trying to explain a biological mechanism for a graph that they won't even know what it is. So it'll sound, like you're panicking and you're just trying to throw biological terms at them. Alternatively, let's say you don't even know what the explanation is, because you might not. The very fact that you've able to start with the title, axis, trends, and values, the person will know what the graph is showing, and then they can give you some prompts as to why it might be doing it like this. But that will be more than a credible answer, even if you get through the first 4 parts of this acronym. So let's go back to the graph and let's do it together. So let's give it a title. So this is a line graph. It's very important you say what type of graph it is. Is it a pie chart, a bar graph, for example? And all it shows is how the blood glucose levels of 2 patients vary over the course of 12 hours. You could mention that the x-axis, it doesn't actually written in hours, maybe that got cut off. And also the blood glucose as well, like what the units are, it didn't have them labeled. Those would be really good. But that's basically it. It's comparing the blood sugar for 2 patients over 12 hours. Really simple. And then the examiner will be like, okay, I can work with that. The next thing is the axes. So the y-axis shows blood glucose and the units were meant to be milligrams per deciliter. And the x-axis shows time in hours, and it covers a period of 12 hours. So already, if you'd never seen this, you could basically start imagining that's what the graph will look like. The next part is the trends. Now, again, we don't want to see any specific values. So what it shows is that the general trend is both patients have steady blood glucose level, and then it peaks at 5 hours, and then it goes back down to the original over the next 6 hours. And you could also say the first patient, patient 1, the orange line, always has a higher blood glucose than patient 2. That's the general trend. After you've done that, now give specific values. So the patient 1 glucose is lower than patient 2. Okay, so patient 1 is the blue line, around 90. The increase is 40 on the 5th hour, so to a peak of 130, before it returns to 90 again within 2 hours. On the other hand, you could say patient 2 has a higher starting blood glucose, around 140. Again, it peaks at the 5th hour, but here, look at the peak, it's much higher. The increase is 80, and you could say that's much more than patient 1. But then the blood key is that the glucose takes much a longer time to return back to the baseline of 140, which is 5 hours later. So you've given the starting point, the end point, and the maximum point, and the key thing. So now you've described the general trend, and now you've gone one step further into showing specific things, which is what you have to do. For example, in a blood test, you'd give the most important blood test to the patient. And that's what it is. The skill is, can you pick out the most important values? For example, saying at the 10th hour, the blood glucose was, for patient 1, 95. At 9, it was 90. At 11, it was 100. Those are pretty irrelevant. The line is basically flat. You don't have to cover that information. And it's testing you. Can you sift through the irrelevant information to the key pertinent information? And then once you've done that, you can offer an explanation. So it says at the 5th hour, the patient show a peak in blood glucose levels, because that's when they probably ate a meal. It's hard to go 12 hours without eating anything. That could be a chocolate bar or a piece of toast. And so that meant that glucose was absorbed into the blood and pushed the blood glucose well. Now, here's where you're offering the biological mechanism. You could say that patient 2 most likely has diabetes because their blood glucose is always at a higher level. But crucially, it takes longer for them to return back to their baseline. And that's because of a hormone called insulin, which is responsible for pushing glucose into cells. And what happens in diabetes is that your body doesn't make enough insulin, or the cells can't respond to it. And that could be the reason why patient 2 has, on average, a higher blood glucose, and it takes longer to recover after the glucose spike. If you gave that explanation, you'd basically come across as a doctor. But also, if you didn't get the explanation, then the person, if you'd explained what the graph shows really well, the interviewer might even say, what condition could the second patient have? Have you heard of diabetes? Could you tell me about insulin? They'll be able to help you and prompt you, but only because you've set the platform up before. And I hope you found that useful. So that's how I'd explain every graph and table. So the question is, what about a photo? I'm looking at this photo. I got asked this in my interview, actually. Describe this photo to me. Now notice that this has nothing to do with medicine, because I don't think I'll ever show this to a patient and be like, this is your results. So again, what are they trying to assess? And it's exactly the same skills. Can you keep calm when they give you something you're not expecting? Can you take something that's a little bit more complex and put it into a format which someone will answer? Can you take this thing which has so many different things on it and basically explain what are the key features? And that's what it's going to do. So for photos, we have a similar method, and it's just 4 things. Title, which is the same as last time. Regions, and that's what I mean, just describe what you see in the background, middle, and foreground, and use those terms. Any key details, and then you can offer your explanation or your inferences. Where was it taken? Offer some insight into the photo. So again, we'll just do that quite quickly. Title. All it is a photo looking down a town high street. That's all I can really say about it. But as soon as I say that to you, you'll have your ideas of what a town high street looks like. So you'll be able to get a general idea if you've never seen this before. Then in terms of region, in the foreground, there's a bin on the left side of the street, and there's buildings with a ground floor shop either side of the street. And these extend into the middle and the background. In the background, that's where you can see some people, cars, and trees. And then you could say the sky is blue with a few clouds. So basically, the guy thinks that this is, a high street during the middle of the day. It's not that busy. There's a few people, and it's good weather. Then you focus on specific details. So you could say the buildings are mainly light yellow and green, and there's about 3 or 4 stories. So it's clear we're not in Manhattan where there's skyscrapers on both sides. There are some tram lines. So, where could this be? There's no road markings. There's some shop signs in a foreign language. So it's likely that this isn't in England. And there's probably about 20 people in the background. So it shows it's not heaving with people. And inferences. So this is where you're offering that explanation. Most likely this photo is taken in a quiet town in a foreign country, and there might not many people, so it might be midday on a weekday because everyone's at work. Or it could be, you know, let's say the south of Spain and everyone's on their siesta because the shops look closed. And if you do all of that and stay calm, again, you'll show those key points that whatever is thrown at you, you can present it in a logical way. You likely will have to pick out different details, but that's basically irrelevant. If you can stick to a consistent structure, you'll come across really well. And that's what we cover in our interview course in the data analysis. We go through different types of graphs. We also cover tables, which we haven't had time to do. We do photos and other types of charts showing specific formulas of how you can stay calm under pressure and answer those. So the conclusion is, with data interpretation, just start simply on what you can see. Everyone says, you know, describe what you can see, but it's harder than that because, you know, you can see a whole photo. How do you know what to pick out or in what order? That's why we've tried to be a bit more detailed and give you a specific structure of what order to present what you see in. You want to start general and then you can build up your answer. You have to imagine that the person's never seen the graph, table, or photo, so be very clear. And just remember, this isn't irrelevant, it's a very essential skill to you for a doctor. And this is probably the station where you can shine at most in your interviews and really stand out from the competition. So I hope you found that useful. What we're now going to do, as promised, is actually go through some questions, and I'll cover them for about 5 minutes, and then Ellie will have a go at answering your questions, and then we can go on to the interview after. So we've got some. So should you define the pillars of medical ethics before explaining them? I think so. If you just bring out words like beneficence, you know, they don't know that you know what it means. And let's say you bring up a pillar of medical ethics, but you use it in the wrong way. If you do that, there is a chance that you might do that, or you don't quite get it right. They'll think that you don't understand. So if you bring it up and define it, at least it shows that you know what you're talking about. And yet maybe you've used it in the wrong way, but you're trying to think along the right lines. Do you need to come up with a conclusion? 100%. There's so many people who just sit on the fence, and what you've done is you haven't answered the question. So it's almost like doing all the working in a maths question and not writing down your answer. You won't get the marks. So the reason they've asked you the question is because they want an answer, and you basically played it safe and not answered their question if you don't give a conclusion. What's the best way to justify your reasoning for an ethical question? I think Ellie did cover this in her session. She said, start by just saying it is a very difficult scenario and there's going to be different viewpoints. Then go through each side. Maybe there's 1, 2, or 3. And that's where you use your ethical terms, and then you come to a conclusion. What research can I do to make sure I have a good idea? So hopefully you should have already done this when you were writing your personal statement. That's all about the work experience, reading articles, read the BBC News website. Probably say work experience and speaking to doctors is the best way to get a good idea of what a career in medicine entails. One of our medical alumni were asked, talk to me for 2 minutes. How would you go about answering this question? So this is the last one I'll answer for a handover to Ellie. Think about what they're asking. Again, remember, take the question and then think, what qualities are they looking to see? Are they looking to see someone who can just chat gibberish for 2 minutes? What I would basically do is I would use this time as 2 minutes extra to talk about why you want to study medicine. So basically I would just answer that. And also in this, the way you can differentiate yourself is by saying any particular skills or any hobbies that make you different from someone else. It is quite a vague question, and the main thing is people might start talking too fast or people might get stumped. So if you have an idea, just pick what you're most comfortable talking about or what you've rehearsed the most, and that probably will be why you want to go to this medical school or why you want to study medicine. And the final one is, what's the best way to reflect on online work experience, online work experience? So again, I would do exactly that 3-part formula. Explain what you did, what you learned, and then further research it. The fact that it's online doesn't make any difference. You can talk about specific details in the work experience. So I'm now going to hand over to Ellie, who's going to answer some more of your questions.
Okay. Hi guys again. Were there any more questions? In terms, will you be marked down if you don't come up with a conclusion in an example of a liver transplant between two people? I think Ankit slightly mentioned this in that it's good to have a point of view and to be able to take your interpretation and translate it into opinion. However, in a lot of questions, there isn't going to be a clear-cut answer. So I think if you are struggling at just admitting that, saying that you're not sure, that it's difficult with the information that you have to make a decision, and explaining how you've come to that conclusion is still an answer. Are you allowed to give your own opinion? So yes, it's encouraged to, as long as it's based on evidence that you've said. Don't just jump to having an opinion without going through the process of how you would have come to that opinion. What should I wear to interview? So I would just dress semi-formal. So not jeans, but not wearing, well, I wouldn't personally wear like a full suit. What are the most important? Hi, how are you? I'm very well, thank you. Well, apart from my cold. Most important areas to look over in the days preceding an interview. It was important to go over your personal statement again and just remind yourself of what you have at your disposal in terms of your work experience and your volunteering, and take a moment to reflect on it and think about what more you could elaborate, as Ankit was covering earlier, in terms of giving you the chance now to just talk further about these things. And then if you've had a thought or written down any ethical scenarios before and looking over it, I remember I had a little crib sheet for those sorts of things that I just had a glance over before. And then the important thing the day before your interview is just to be calm. You want to have a conversation on the day, as I keep saying, and be relaxed rather than having stayed up all night trying to revise something that at the end of the day isn't going to help you. Great. I think that might be all the questions that we have. So we'll move on to the mock interview now. And I'm just going to go off screen and be asking Ankit some questions. So we'll just transfer over.
Hi again, we're back. So what we're going to cover now is a mock MMI interview. We're going to pretend that we're doing it over Zoom. So I'm wearing what I would wear, probably wear a shirt as well. Might have a desk in front of me, not so I can read off my notes, but if they're presenting with any information, I can write things down on my whiteboard. And Ellie's going to answer me questions over the thing. And you might not be able to see your examiner, their camera might not be working. So she's basically going to read out some questions, and I'm going to try and give my best answers to the different stations. So let's start. So I should probably start by, good morning. I'd introduce myself, give my ID badge. My name's Ankit Chadha. I'm applying for, let's say, Queen Mary University. So that's Barts in London. And they'd welcome me and then start asking me these questions.
Okay, so hello Ankit. Thank you for coming today. It's very nice to see you. I just want to start with sort of a basic question of why do you actually want to do medicine?
Okay, sure. So there's many reasons why I want to study medicine. As I said in my personal statement, the main reason I like to study is because I believe it's one of the only professions which gives me the balance between academic work and also the patient side, and I'm interested in both. So in terms of the academic side, I'm really interested in the science that underpins the human body. For example, my favorite subjects at school are biology and chemistry. And I really enjoy learning about how specific organ systems work together to produce the human body, starting on the level of a cell and then working up to the tissues. And that's something that I'd like to explore more at university. In terms of the patient side, I really like interacting with people and specifically using my knowledge to help patients improve in their health. I saw this when I did my piece of work experience. I was shadowing an orthopedic surgeon, and I observed him in the operating theatre for people who'd come in with acute traumatic conditions. Some of these people were severely unwell and they had life-threatening injuries. However, before doing the operation, he was able to interpret the CT scan and basically design complex surgeries about which areas need to be fixated first, starting with the blood vessels and then the bones and then the soft tissue. And I felt that systematic approach of using the science to then improve and save the lives of patients was really fascinating, and that's something that I'd like to do. And then speaking to the patients afterwards and their families as well, I understood the importance about what the doctor's role is, not just in terms of saving their life during the operation, but that continued cycle of care, both before, during, and after the operation. And that's something I'd really like to be part of. So in summary, it is that combination between the scientific aspect of applying the biological and chemistry principles, and then using that to improve patients' lives and that face-to-face interaction with patients that really make me want to be a doctor.
From that experience, did you want to study orthopedics? Do you think that you would want to specialize in that?
I think orthopedics is a really fascinating speciality, and I really enjoyed my placement. In there, I saw the different types of surgeries, and particularly I was interested in the hip and knee. And specifically, I saw this thing called the Lizarov surgery, which is used to lengthen patients' legs, and the apparatus was really cool. However, I also understand that I've only had a glimpse of what the specialty entails. I'm really excited to go to a university and medical school, and in my clinical years experience a range of medicine. So whilst I am interested in orthopedics at the moment, who knows, I might change in the future.
Fair enough. So Ankit, why did you want to apply to this university?
Okay. So again, there's many reasons I'd like to apply to this university. The first and most important reason is I really like the course structure. So I understand that the course structure from doing research and speaking to some students is that it's PBL, which is problem-based learning. And my understanding of this is that you work in small groups and you're presented with a clinical problem. And then you learn the science behind it, you can maybe meet a patient with that condition, and then you're basically learning the different scientific principles in medicine as you try and encounter this problem. I really like this course style because I think it fits in really well with how I like learning things. So at school, I go to these chemistry extension classes after school, and we get given a lot of problems. And I think it's really fascinating when you're confronted with a problem that you don't know, and it's that challenge to try and gain different pieces of evidence. Also, I think it's much easier to apply what you're learning if you've seen it in real life to a direct clinical problem. And that's why I think a PBL course structure and working with different members of the team would be really good for my learning style. On more traditional aspects, I think wouldn't be as good because I really want to get patient contact. As I said, one of the main reasons I want to do medicine is to interact with patients and see how you can use science to improve patients' lives. So that challenging style of learning, as well as early patient contact, really make me want to apply to Queen Mary. Apart from that, I also really want to be in London. I live near London, and I think being in London will allow me to see patients from a wide variety of cultural backgrounds. So I'll be exposed to many rare conditions that I might not get to see in other parts of the country. I know the area has a high percentage of an immigrant population, so it'd be really cool to see the cultural differences in their attitudes to healthcare, and maybe because there's a lot of travel in and out of the country before COVID, I would have got to see lots of infectious diseases and maybe exotic diseases that I might not get to see. So it really is that combination between the course style and the location. And then finally, I was also doing some research about the clubs and societies, and I'd really like to join the Queen Mary Asian Cultural Society. I've got some friends in there, and that's something I do to de-stress from medicine. So I'd like to also contribute to that.
Okay. What do you think you would contribute to the university?
So outside of medicine, I do engage in some activities. So as I've said, I would like to be part of the Asian Cultural Society, and through music and dancing and organizing the Asian Cultural Show, which happens once a year. I like to be part in that. At school, I was involved in a lot of musical things. I played the guitar and violin, and that's something I like to continue at university. Also, I know Queen Mary has a good sports program, and I know I probably don't want to play for the university, but I would like to play for the Medics Association Football Club, and I think I could get quite involved in that. There's also the Science Club, which I'd like to do. I think there's so many potential things. Maybe I'll have to balance it with medicine, but those are three things I'd quite like to get involved in at university.
You have mentioned quite a few things. How do you balance your time?
So I think balancing my time is going to be a challenge, but it's also been a challenge at school, balancing my UCAS application, balancing applying, trying to get the grades and all the activities I'm involved in. I did find this hard at some point, and I almost found that I was taking on too much. But then what I do is I talk regularly to my friends to try and understand what they're doing and not do too much. I also have a diary where I try and write down everything to make sure I'm be organized. And I think the key is I take every Sunday off to make sure I'm not working all the time or doing anything. And that helps me really recharge and go for the next week as well.
Okay, let's move on to the next station.
Sure.
So, this is a table. Firstly, I'd just like you to describe what you're seeing.
Could I just have a minute or 30 seconds to just have a look at the table, please?
Yeah, of course, go ahead.
Sure. Okay, so from my understanding, this is a table probably of a study which shows the blood pressure in 7 female patients before and after giving them a drug. There's the independent the first column is the number of the female patient. The second column is their blood pressure before the drug was given, and the units are in millimeters of mercury. And the third column is the blood pressure after the drug was given, again in millimeters of mercury. Describing the general trends, it shows that on average, you can see that for each of the patients, the blood pressure was higher before the drug was given than after. And I think that's consistent for all the patients. In particular, the patient with the highest blood pressure before was patient 5, who had 170, but after it shows that the blood pressure was reduced to 149, which is a decrease of 21. Looking at the table more closely, there's the biggest blood pressure decrease was in patient number 4, who started with 165 and then finished on 126, which is a decrease of 39 millimeters of mercury, which was the biggest. The smallest blood pressure decrease was, I think, in patient number 3, who only had a decrease of 11 from 140 to 129. What I think this graph is trying to show is the efficacy of probably a blood pressure medication in reducing blood pressure. And I think what it shows is that it's more effective when the blood pressure is higher, for example, 165 or 170, than more normal ranges like 140. But in all people, there's a consistent range where it's consistently lowering blood pressure. So I think it shows that this drug is effective in reducing blood pressure in this group of patients.
Is there any more information that you would like to know before coming to that conclusion?
Yeah, I think there's a lot of variables that we don't know about. For example, we don't know the age of the patients. I would like to know if they had blood pressure problems before. I'd also like to know the time, before and after. How long was it measured after the drug was given? Maybe the dose of the drug. I'd also like to know, was it controlled for? What were these people doing when the blood pressure was measured? For example, were they running and then they were resting, because that could influence the blood pressure. So all like the control variables to see if they were, controlled for during the experiment.
Do you think you can make a conclusion off the basis of 7 patients?
I think in this study, there's a very low sample size, so the reliability will be in question. However, I think this, provided that all those variables were controlled for, I think you can draw a weak conclusion that this drug is effective in lowering blood pressure. We don't know if it would be the same for male patients. So that's something that I'd like to do further as a follow-up experiment.
And like you said as well, you wanted to look into age. Okay, great. Let's move on to the next question. So you're a doctor in a GP practice, and a 14-year-old girl comes in and she's asking for the oral contraceptive pill. Would you give this to her?
So I think this is a very difficult ethical scenario, and there's points on both sides to consider. I also did see a scenario similarly to this when I was doing my work experience at a GP, so I know how difficult it can be. I think before you give it to her, you have to consider both sides. So on one side, in terms of the pillars of medical ethics, there's the idea of autonomy, that people should be free to make their own decisions. And in this case, if the 14-year-old wants to do that, there is almost a duty to respect her, her decision, and provide her with the drugs. The next thing, in terms of the principle of beneficence, you could argue that giving her the contraception is in her best interest and will do good for the patient, because if the patient were to leave and then become pregnant, that could negatively impact her mental health and her physical health as well. Alternatively, in non-maleficence, to do no harm, you'd have to appropriately screen her risk factors. I know that there's different risk factors when giving contraception because they have estrogen and the combined pill. So I'd have to assess her physical health and her blood pressure and stuff like that before giving it to her. Also, in this scenario, I think what I read about is that it's quite hard because this 14-year-old is a child. So she's not yet an adult, and she might not have the capacity to say that, to consent for a treatment, which is this pill. So I was doing some reading and I learned about Gillick competence, which is where if someone is under the age of 16, but they can demonstrate that they are competent, they do have capacity to consent for this. So I would before giving it, I'd have to assess whether she understands what she's asking for, the risks of having it, what might happen if she doesn't have it. And then if I deem her competent enough to make that decision, then I would have to respect her autonomy and give it to her. Also in this case, and I know it might be hard, I would also check, whether she understands whether she has told her parents. If she is, I wouldn't break her confidentiality and tell her parents, but I might encourage her to tell her parents so that they are aware. I'd also want to check who her partner is, if there's any evidence of safeguarding. Is she with a much older individual? Is she potentially at risk of being sexually exploited? So I'd have to investigate that. And I think, given that if I was just starting, I'd probably also raise it to the practice manager or the lead GP before making this decision. But I think in conclusion, if there were no safeguarding concerns, if she understood and I deemed her Gillick competent, then I would have to give it to her, and if there were no physical problems as well.
Okay. You mentioned confidentiality there. Can you just expand on when you think it would be appropriate to break her confidentiality?
So confidentiality is really important because it maintains trust in the doctor-patient relationship. And my understanding of confidentiality is that you have to keep a patient's confidentiality and their information between yourselves, unless there is a risk to the safety of that patient or the safety of others, or it's required by public interest, for example, due to the law. So if I thought she was going to take this and, for example, overdose or kill herself, or maybe not in this scenario, someone told me that they're about to commit suicide or go out and harm individuals, I would break confidentiality, and I think it would be fine to do that then.
Okay. All right then. Well done, Ankit. Let's move on to the next question. So I did have a little read of your personal statement. I thought it was very good. but I'd just like you to tell me what you think the best piece of work experience out of all of that was.
Okay, the best. It's quite hard to choose the best because I did enjoy all of them, and each of them taught me a new skill. I'd say probably the one that's the most memorable for me is when I shadowed an orthopedic surgeon, and I saw him, cover a range of different surgeries. That's because I quite enjoy surgery. So in terms of that, I saw a particular surgery called a Lizarov surgery, where they used an apparatus to lengthen someone's leg. And that was really fascinating as I went after to read about how this surgery got invented and the scientist who came up with this piece of apparatus. And I think through that, I learned about the importance of research and, in medicine, and how all these new surgical techniques that we're learning about come through research. And that's a skill that I'd like to develop and do more about in independent research projects at university. What I also liked about this work experience is how there was a mix between spending time in the theatre, but also interacting with patients in the clinic. I did see that the doctor had to break some really sad news to the patient, that they'd got a bone tumour. And I found that really difficult. But the way that he spoke to the patient and their family in a really calm and caring way, giving them plenty of time to take on the knowledge and also ask plenty of questions, I found that really caring. And although the cancer was probably a terminal diagnosis, it was still really amazing to me how the family actually thanked the surgeon at the end of the day, despite him giving them really bad news. And that made me realize that in medicine, it's not just about saving people's lives, it's just about providing good quality of care and treating your patients with a lot of respect through good communication. And that's something that I feel will stay with me throughout the profession. And those two experiences made me want to do medicine even more.
What do you think the doctor's good communication skills were?
So I think one of the best things was he established what they knew already, and he also asked them what they wanted to know. Because some people, like me, if I got diagnosed, I'd want to know absolutely everything. But I know some people are a bit more scared and they might not want to know the ins and outs of their diagnosis. And some people might not want to know it about it at all. So the fact that he asked them, he knew what level of information that he gave. And I think that's really important and something that some people might overlook. What was also really good is that after he gave it, he paused and he didn't try and shove too much information down. He let the patient have enough time to take on the knowledge, and then only once he was calm and had got over that initial shock did he start providing more knowledge. That was really good.
All right, Ankit, I have one final question for you. You mentioned research. Have you managed to be involved in any research before?
So at school, I did an EPQ, which is an extended project qualification. And in that, I was looking at, is there a link between your chess ability and your intelligence as measured by IQ? So I set up an experiment where I called 10 friends over and I gave them an IQ test and ranked them in order. And then I also organized a chess tournament so I could put them in order of chess ability. And then I used a correlation, Spearman rank, to see if there was any correlation between the two. And I did find that there was a weak positive correlation. And then I did more research and presented it at the local EPQ meeting.
Very good. All right, Ankit, thank you very much.
No worries. Thank you so much. And thanks everyone for listening. I had to do most of that off the cuff, so I hope that passed in your eyes. And I hope you found that really useful. I'm not saying that my way is the best way to do it. It's just a way that, I just tried to stay calm. I didn't know the questions were coming up, and I actually hadn't seen that graph before. We did try and make it as realistic as possible. So there were some umming and ahhings, but I would have taken that if that was my interview. So what we do now is, before some questions, I just want to say that with a bit of preparation, you all are capable of absolutely acing your MMI interview. And you've done a really good thing by coming here this morning, which I think will stand you in very good stead. What I would say is that if you have found our course useful, or if you have found mine and Ellie's teaching style useful, do please check out our MMI course on In2Med. which is our online medical education portal. Ellie is going to drop the link into the YouTube chat, and we'll also send you an email about this later. And so for all attendees of this webinar, we're giving it a one-off a third off voucher code. So our interview course is usually 75, but if you use that, it will be only 50. You'll have access to this for 6 months. So by the time till the interview season ends, and you'll be able to watch it as many times as you want. This code, however, is only available for, for the webinar attendees, and it will expire tomorrow night at 11:59. So it's basically as a thank you for coming. And what we do is we expand on every single part of this and also much more. We start by the first lesson. Hopefully you managed to see it it's on the preview, which you can watch for free. But we expand on how to use your personal statement. I cover the photos in more detail, the graphs, how to describe the tables. We go through specifically telling you what you need to learn about consent, confidentiality, those different pillars of medical ethics. And then for each, we have about 4 or 5 examples of how we exactly structured our answers. We also go through another mock MMI where we've got recordings of good and bad answers. Because sometimes, if you just see one, you don't know. I want to show you as well what a bad answer is, so how you can improve on that. And so the code is, so Ellie's got that, we'll drop that in the chat as well. When you go to checkout, just drop that code in and it will automatically apply for you. But I do want to say thank you to everyone for coming. If you enjoyed this, as I said, do check out our course. We do try and go one step beyond. None of what we do is about giving generic information. I've tried to make this as detailed as possible, and the whole course would probably take more than a day if I, tried, which I don't expect you to stay for, or we couldn't cover in this short period of time. I'd also like to thank Paul, who came on a Saturday. He's recovering from COVID, so I hope he gets well soon as well. And Ellie, who's also got a bit of a cold. She is COVID negative, just if anyone was wondering. So what we're going to do now is just open up to some final questions. I'm going to go onto the slide. If you have any more questions to ask, do answer that now. If you have any questions about the course, do ask them now. Or if you're not comfortable, just email us in. We're happy to answer any of your questions. Again, we'll be summarizing all of this in the email that we send out to you. So just do let us know. I think we've answered these two. I've not been answered the ones that were short. I think with this, the fact that you can use this as your strength. You can say due to COVID, you weren't able to attend many, but you've still been trying. And the fact that you've done a few will come across really well. Remember, you're doing work experience not to become a doctor, just to sample what it's like and demonstrate your qualities. Even if you've only done one day, there's so much that you can learn in one day of work experience. Say you were asked about an article research paper you've written, how much information should you know about it? I'd say you should know about it in detail. And that's one of the things that we do cover in lesson 4 of our course. So I will point you to that one for there, where we've gone through some examples, giving you what research paper or article you could present and exactly how you do that. Again, we've come up with our own, structures and clear acronyms that hopefully you should find it easy to remember so that you come across in a very structured way. Should you mention specific names, hospital? Yeah, I would. Why not? It just provides more detail in your answer and it makes it seem like you did actually go there rather than make it up. So definitely. I'm going to invite Paul to switch his camera on if he's still with us. If you want to ask him any questions as well. You are. So if you want to just unmute yourself. Do you have any advice for interviews that you record in your own time? How can I stand out when everyone will research answers?
Is that for me?
I'm struggling to understand that question a little bit, to be honest.
Yeah. I think standing out, you've got to come across as being very genuine. If you rehearse too much, the person you're not, that'll stand out. I think to come across as being different, be absolutely genuine and be yourself, but do the work, do the background work that Ellie and Anka have been talking about. You've got to be really well prepared for these interviews. If you're not well prepared, it will show. if you are well prepared and you, the genuine person, is coming across, that's all you can do. There's no more you can do. So I think just be genuine, but be really, really well prepared.
Sure. I think someone also answered what's involved in the MMI course. So basically, it's a 10-lesson course covering each of the different stations. The first part is that what you need to do to prepare for the interview. For example, we'll tell you what to read, we'll give you material to read, what to prepare, what to learn, what graphs will come up, how to interpret those. And then the last 5 lessons are all about, you know, with examples, specific examples, good and bad answers, what to do, and how to answer those, trying to be as detailed as possible. Would it be if you had a sheet of notes with you at the interview? I don't think it will. If it's in person, you won't be able to bring anything in. You might not even be given a pen, so you wouldn't be able to do that. What's the best thing to say when asked to tell me about yourself? I think we covered this earlier. Remember, what they're not interested if you're a chef. They're interested if you are a suitable doctor. So think about all the things that they want to hear. Can I ask about charts? Well, yes, of course they can. A pie chart, charts, bar graphs, and yeah, we cover those different parts in, I think it's lesson 5 of the course. What should you prepare for an article? I think with the article ones, I will point you towards it. It's too much to explain in a 1-minute answer. So if you are interested in that, and I mean it probably will come up, do check it out. Ellie's posted the links and we'll send you more information in the thing. One thing that if you also want some more help is if you follow our Instagram account, it's at In2Med UK. Again, it'll be in the email and the thing, and the YouTube chat is we do put a daily MCQ multiple choice question on there, and that can start getting you in the mind thinking about different parts of medicine. So it's just a helpful way of ticking along with your biological knowledge, AS level knowledge, maybe some medical knowledge that might help you stand out at the interview. So I definitely follow that, and it's very interactive, and it's on the way home from just answering an MCQ. A multiple choice question can really help you. So do follow our Instagram if you want just daily medicine questions to answer. We'll answer a couple more before we'll call it a day. Thanks, you've been a great audience. Will basically seem too repetitive. Lots of the answers have the same experiences. I don't think so. Well, do you want to answer this one?
No, I think the whole point, what Ankit said earlier, your personal statement is an essay that you've written about yourself. You must know that really, really well. Imagine a situation where they ask you something about your personal statement, and you're struggling to remember, which book did I read? I can't remember, what did I say now? It'll come across really badly. So they expect your personal statement to be a really important part of the whole process. So the fact that you're using it, that's exactly what they want you to do. You're taking experiences from it and relating to it. And Ankit said something really important earlier, that because the personal statement is so limited in the number of words and characters you can use, it might be you've only hinted at a few things, which at interview you can then really embellish. So you might have written a sentence about something in your personal statement, but now's the opportunity to talk in detail about it. It's really interesting watching Ankit do the mock MMI interviews, how long he was talking for. I don't know if you noticed that. I was trying to time your answers, Ankit, actually. I had my watch out to see, and you were talking for 1 or 2 or more minutes, which is really important. So they want you to give extended answers. And the fact you've got 1 sentence in your personal statement, but you turn it into a 2-minute answer, that's really good. That's showing so much about you. So I wouldn't be concerned about that at all, about being repetitive. If the interviewers don't like what they're hearing, they'll stop you. They'll interrupt you and move you in a different direction. So I would say keep talking, practice talking for 1 to 2 minutes about an answer with confidence and with clarity. Don't worry about, am I talking too long? If you are, they'll stop you and move things on.
Cool. No, that's great. It's nice to. It's also, I can see people following the Instagram account. So yeah, there's a lot of. I don't know if you can see this. That's just that's the MCQs and the piece of medical knowledge. So if you just do want that a bit every day, then that's what we'd recommend. Just to see if there's any more questions. How do you deal with nerves? So I think with nerves, you are going to be nervous. Okay, I'm confident now because this was a mock MMI in my house on a Saturday morning. There's nothing really going on this. But the best way is preparation. If you know what you are going to talk about, if you know what they are trying to see, then you know how to become that person. I'm not saying act, or hopefully you do all want to study medicine for the right reasons. But the best way is I always feel, if you feel prepared, you can go in with confidence. This is not an opportunity for you to slip up. You should treat this as an opportunity to shine. And that's why if you are doing, the harder stations, like the ethical stations or the data interpretation, if you have those, those acronyms, if you have that structure, you know you're going to shine, because whatever is thrown at you, you will have a way of answering those questions. And I don't know if you want to use my method, you might think it's me, but the way I always see nerves, and this is harder if it's over Zoom, so I always used to go and I used to see other people and how nervous they were. And that would just help me see that, okay, everyone is in the same boat. Whatever I'm feeling, they're probably feeling it as well. Or they might even be more scared than me. Everyone's just trying to hide. You're all in the same boat. So don't feel scared. Should you be honest if you don't know the medical, like, I didn't know what was showing, that was showing in yes, of course. That's what I said. You're not expected to get the explanation. When in my actual interview, it was about a biological thing that I hadn't even covered, but I had presented it in a good way. And then at the end, they helped me. They said, okay, have you considered this? Or this is about, I don't think it was about insulin. It was actually about glucagon. We probably don't even cover it in biology. And I said, I haven't covered this yet. So they said, okay, well, this is how it works. If this is how it works, does it explain in the graph? And I said, well, if you're telling me this is how it works, then it does explain the graph. So this is probably what it's trying to show. So just make sure you do the first 4 parts, and then, they'll help you with the rest. So let's just see if there's any more. I'm just going to see how many people are still watching to see. Okay, so we still got about 125. So it's clear that people still want to answer questions. So, Paul, if you're happy to continue for another few minutes.
Yeah, sure.
Okay, so tell me about a scenario you encounter if you only have online work experience. I think you can cover this, Paul. If you're happy
to. Yeah, I think with COVID, it has made the whole work experience thing difficult, but that doesn't mean you should have none. The idea of the work experience is to give you insight into the profession. So what you're trying to say is, I have gone to some trouble to get insight into what this job is all about. If I couldn't get face-to-face work experience, it doesn't matter. There's a number of places offering work experience virtually, because they know it's difficult with COVID, and you've just got to draw on that. So you're showing them an interview, you have made an effort. It hasn't been easy, but the whole process isn't easy. Being a doctor is not easy. So you draw on what you've been able to do. So even if it's online work experience, it is still very valuable. The important thing is you've reflected on what you've seen, or even on what you've heard. So think about, what did I observe? What did I learn from that? How does that help me think about being a doctor and what a doctor does? And how would it sound when I articulated it into you? So practice getting someone like you've seen with Ellie and Ankit today. Get someone to ask you questions, you answer them, they time you, they tell you how long you spoke for, and they give you some idea of how it came across. But I don't, this work experience thing, if you can't get real work experience, online is all you can do. That's all you've got. Make the most of it.
Do we treat the interviewer as doesn't know about medicine or the med school? Just wondering, as you explained the course structure, but they would know. So again, this is like, even if it's we just covered this with the ethical questions. They probably do know the 4 pillars of medical ethics. Obviously, if they work for that medical school, they do know their own course structure. But it doesn't matter what they know. They need to see that you are aware. So whenever you get the chance to explain something, notice in my interviews, what I was doing is I was trying to define everything. And what that shows is that I have done plenty of research, which makes me seem quite motivated and keen. And it also gives me more time to think of answers that I would want to do. Because if you try and jump straight in and do it, you will probably get in a bit of a muddle. It's a very difficult skill. So buy yourselves time, do explain, because it can't hurt. You're giving out good factual information.
Ankit, can I just take a question that popped up that's disappeared? There's someone said, if you get rejected from all your applications and don't get any interviews at all, it's a bit demoralizing. What do you do? That's going to be quite common, I think. So from when I heard from the med schools, they were saying the majority of students get no interviews at all, which I imagine is incredibly demoralizing. But to me, it's all part of the process. So when they talk about their way of interviewing and offering places is not perfect, they know that a lot of very good candidates will be either not interviewed or interviewed, they're not selected for being offered a place. So if you really, really want to do this thing, if medicine is genuinely what you 100% want to do, then you take a gap year. In the meantime, in year 13, your second year A level, as a teacher, I'd say to you, get your grades. If you don't get the grade, you can't apply. So if you've got no interviews at all, or you've not been offered anything, fully focus on getting the grades. If you can get your A's and A stars, then in your gap year, when you reapply, you're in a much stronger position now, because they're not wondering, I wonder what grades this student will get. You've got the grades. You're showing determination. You're showing resilience. And next time around, hopefully you'll be much better prepared for the interviews. So yeah, do be prepared for the fact you may get no interviews or you get no offers. But if you genuinely want to do this, do not let that put you off. I do know someone local to me who had exactly the situation. They took a gap year, got some interviews, didn't get any offers, but took a second gap year and then paid to do some online courses about how to do interviews, and finally got into medicine. And you'd have to admit that this person was showing real grit and determination, having to take 2 gap years, but they still got in. They didn't give up, and they had a very positive attitude to getting into medicine.
That's really good to hear. And we know people as well. It doesn't matter if you have to take a gap year. At the end of the day, it doesn't even matter what medical school you go to. Now that we're working, no one ever asks what medical school you went to, and you will be a doctor at the end of the day. I'm just going to mention 2 points. One is a question, but if you look at the YouTube chat, Ellie has just dropped in the link to our preview lessons. That's lesson 1 of the course, which is available free of charge. I did send in an email to look at that one before, because that's basically quite a generic lesson, just about the structure of the MMI, but it also covers in detail at the end what the rest of the course will entail, because I know some of you were asking about that. The main part of that is you also get to see the format of it, that, see how it looks on the screen if you like that teaching style. We've tried to make it that it's almost like us two directly speaking at you, and, doing that. Just 1 second. Okay, that's better. So that basically shows the PDF. Each lesson has a booklet which you can download, and the idea is that you annotate that as you watch the video, and then also the video should cover anything and watch it as many times. There's also a question, how do you deal with role play questions? So again, I'm really sorry we didn't have time to cover that today. In lesson 4, that's where we do cover ethical scenarios and the communication stations. I'd love to stay here another hour and cover and discuss how we do the role play and the communication. For that, again, I'm sorry, I will have to point to the course. There's only a limited amount that we could cover today, and I'm not going to try and answer it in like 30 seconds. We'll have just a couple more, because I know we're finishing at 12. We've seen that, could they test manual dexterity in an online interview, and if so, how? I don't know how they could do this, actually. I don't think they will. And realistically, unless you're doing surgery, you don't need to have that much manual dexterity. You need to be, not the clumsiest person and safe with your hands. But in terms of the qualities for a doctor, I think it's quite down on the priority list, and I can't see how they'll do this. Let's just see if there were any more. The article we've answered. Paul, do you know about the Cardiff written exam?
I don't actually, no.
Unfortunately, I'm not sure about that specific one, so I think you'll have to look that up. Sorry. We have a question about the max number of years you can take. Is that as a gap? Oh, okay, for a gap year. It really is open to you. You can take as many years as you want. There's some people doing graduate medicine. You can also do another degree before doing that in terms of graduate medicine. But also in terms of gap years, we have people doing an undergraduate course at the age of 30. It really is up to you.
Can I just say there, Ankit, with the age of the candidate, I think the older you are in many ways is an advantage. So, because it's a tough job you're doing, you know, if you're age 23, 24, trying to run a ward in a hospital, you're the only person on duty that night. That's pretty tough. And in terms of graduate entry, Ankit, I was talking to a student the other day. He did his degree in biomed. He did a master's in biomed, and then he started undergraduate medicine. And I did say to him, well, who's paying for all this? And he looked at me and said, well, I am. So, you know, he's done his 4 years of sort of degree and master's, then went into medicine. But then there may be funding available for you, but there are different routes in. So he's aged kind of 26, 27 now in year 3 medicine. But I think all his experience and age will be a distinct advantage to him.
Sure. No, that's great. It's also great to see Ali posting on our YouTube thing. If you also have time and maybe you have friends, do check out Ali Abdal's course on our website, which is how to, if you're thinking of studying medicine in America. So do get a chance to check that out. I think we'll ask one last question if any more are coming through, and then we'll basically finish. Okay, so basically I'm going to go back to here, and I just want to cover this slide, the take-home message. Okay, because this is something I know, like, this is a hard time of year for everyone. I went through it about 7 years ago, and it was the most difficult time of my life. I was doing 4 A-levels. I was trying to do a lot of extracurricular activities at school. I had my interviews. I had Cambridge interviews as well. I'd just done the BMAT. Was tired from the UCAT before. I'd done my work experience. I had to read all the books before my interview as well. It's a stressful time of year, okay? No one is going to take that. And anyone who says, no, you should be able to do it, you know, easily, it's fine if you're finding it tough. However, you just got to hang on a little bit more. If you get through January and you get that offer, trust me, it's one of the best feelings in the world. And then all you have to do is get your grades to go in. And that summer, hopefully next summer, I mean, we don't know what's happening with the pandemic, but hopefully it's over by then. We just touch wood. But that summer will be the best summer of your life. You can travel, just take some time. It's basically the first summer where you don't have to think about anything. And then you can get into that medical school and, you know, enjoy Freshers' Feast. And every year there's about 8,000 medical students who go in. They've all been through the same process as you. And what will happen is in a few years, you'll look back, you might even be doing these sessions, teaching the new students and giving them advice how to get in. You'll basically laugh at the process and ask, why did you get so stressed? So no one's blaming you that it's a stressful time. With a bit of a preparation, you all are capable of not just doing well, but absolutely acing that MMI interview. People like us are here to help. If you enjoyed our teaching style, do check out our course. Eddie's basically put one last reminder on there. So there's the link and there's the discount code, which will expire tomorrow night. So if you are, then try and save a little bit of money by buying it before then. But I honestly wish you the best of luck with your application. And Eddie wishes you the best of luck as well. And if you have any questions at all, feel free to just, you know, email us. You can DM us on the Instagram, and we hope to go from there. You've done very well coming on a Saturday morning, and I hope you guys have a lovely weekend and a Merry Christmas and New Year as well. Thank you so much. Hopefully maybe see you on the ward sometime as a doctor. Bye.